Hello everyone and welcome to this research presentation overview on behalf of the social media platform, the RPSG, the Renal Patient Support Group, and where this research poster presentation was a collaborative between the social media platform and an academic institution in the United Kingdom, and where collaborators were from the academic institution as sort of postgrad science and or pharmacology students, and this research poster presentation is an update and a sort of a review of an important topic, that links neurobiology, but also in line to immunobiology and aspects of biochemistry and pharmacology, and where this research poster presentation looks at Huntington's disease in the 21st century. This research poster presentation is based on sort of where students had developed a peer review manuscript, and peer review manuscript in around this topic, before this research poster presentation had been put together. To begin with, then, on this research poster presentation, a look at the aims, of this, and the aims being where the aims were to collate current investigations and to highlight sort of novel pharmacotherapeutics or treatments for Huntington's disease, to elucidate how far healthcare has advanced for Huntington's disease or HD recipients. So a bit of intro. Although the earliest known description of what is now recognized as Huntington's disease or HD dates back to the 1800s, around 18 to the 18th century, or 1842, by investigator Waters, and it was not until the physician George Huntington in 1872, sort of the latter parts of the 1800s, in a publication on looking at the accurate characterization of a symptomology, of one of the main symptomologies in Huntington's, being chorea. That's spelled Chorea, and where the condition became broadly known as Huntington's chorea. However, a decade sort of later, in around 1983, in around the 1980s or 1983 particularly, a breakthrough in the genetic understanding occurred when HD was linked to specifically chromosome 4 in context of genetics, and the Huntington gene HTT responsible for HD was where the Huntington's gene HTT was identified to be responsible for Huntington's, and it was specifically or particularly isolated for further investigations. HD is a hereditary neurodegenerative disorder or condition characterized by motor, cognitive, and behavioral disturbances. Most dysfunctions include both involuntary movements, such as the symptomology chorea, rigidity, and involuntary movements such as dysarthria and and dysphagia, which compromise sort of balance, posture, speech, and swallowing, and hand coordination and eye movements. And despite the hyperkinetic movements such as Chorea, HD recipients often begin to experience other symptomologies. Cognitive impairment in HD is characterized by a decline in sort of a higher central nervous system functions, including deficits in decision making, memory, learning, and visual spatial processing, impacting the patient's or recipient's ability to function independently. At the same time, mental agility manifestations such as anxiety, irritability, aggression, and obsession are sort of notable, or have been in amongst the literature, have been in amongst the literature evidenced and notable in HD recipients. So now looking at some of the epidemiology. So HD is relatively, it's sort of still a sort of although there's been much literature and investigations, HD is relatively a rare neurodegenerative disorder. Yet its prevalence demonstrates significant variation across ethnic and geographical populations amongst individuals of European ancestry, particularly. HD is HD prevalence ranges from approximately 5 to 10 cases per 100,000, whereas lower prevalence rates are less than 0.5 cases per 100,000 have been reported in the African and Asian population. A recent systematic review and meta-analysis encompassing 33 epidemiological investigations conducted between 2010 and 2022 reported a global prevalence of just under 5 per 100,000 which with the highest regional estimates observed in Europe, and then in North America, and the lowest in Africa and East Asia. The findings supported the investigations from European populations which have documented prevalence rates ranging from 10.6 to 13.7 per 100,000 amongst individuals of European descent, and lower prevalence was reported in Asian and African populations compared to the Western European and American populations. One study estimated at the same time that the Huntington's disease prevalence at approximately 1 in 8,000 individuals is in amongst the United Kingdom or UK, and at the same time in amongst a sort of a side basis of Huntington's being a sort of juvenile Huntington's disease represents a small yet variable proportion of all Huntington's cases, with a meta-analysis reporting a range of 1 to 15% cases. So now looking at some of the molecular bases. So Huntington's is an autosomal dominant hereditary neurodegenerative disorder resulting from pathogenic expansion in the HTT gene, located again on chromosome 4, and the Huntington's arises from pathogenic expansion of the of in around the amino acids of the amino acids of particular amino acids and in around these amino acids and that where there are trinucleotide repeats within the HTT gene exceeding the normal polymorphic range, and during the individual's lifetime, further increases in repeat length can occur in in specific somatic tissues, particularly with the striatum and cortex, and this is a phenomenon known as the somatic expansion, which contributes to variability in disease onset and progression. The expanded tract encodes an abnormally long polyglutamine sequence in the N-terminal region of the Huntington protein, prompting a sort of the misfolding and aggregation and neurotoxicity characteristic of the neurotoxicity characteristic of Huntington's. In amongst this, aspects preceding this research poster presentation, the students had developed a literature review, and as part of this research poster presentation, there is a little bit in around the methodology in around this. However, for the purposes of this research poster presentation, it won't be where there'll be a sort of overview in the methodology element. So listeners can look to refer to the research poster presentation through this recording and to identify with the information that is within this research poster presentation to see how the students actually put together the methodology element, which includes elements in around the literature search, information sources and search platforms, the inclusion criteria, exclusion criteria, and the study selection and data extraction elements in around the methodology aspects. And so on from there, looking at some of the diagnostics and clinical practice. So pharmacological interventions for Huntington's primarily aim to manage symptoms, as no therapy currently halts ultimately or reverses Huntington's progression. Symptomatic therapy is guided by the predominant manifestation and individual patient needs, with the main symptomology again being chorea, relief being a central target in many procedures. Diagnostic evaluation begins with a detailed clinical assessment of the classical motor, cognitive, and psychiatric features and comprehensive family history, followed by the confirmatory molecular testing or investigation for expanding amino acids repeat in the HTT gene. Pre-symptomatic testing or investigations can be offered to at-risk or suspect or at risk adults for structured genetic counseling and staging systems such as the HD integrated Huntington's integrated stage system, or UHDRS, and the scales or measures such as the Scholsom fan scale, including metrics such as the total motor score, or TMS, and total functional capacity, TFC, and symptom and additionally the symbol digit modalities test, SDMT, and the and the composite UHDRS are essential for quantifying, or have been essential for quantifying disease burden in Huntington's and for eligibility determination for clinical trials. Emerging biomarkers including PET derived from PDE10A alterations, and MRI based striatal volumetrics may detect or can help detect pre-manifest changes and track disease progression. In around looking at some aspects of clinical trials and the pharmacological interventions. So a substantial advance in Huntington therapeutics has emerged with what have been referred to as AMT 130, being one of the first gene therapies to exhibit a clinically meaningful deceleration of Huntington's disease progression in trial participants, and the intervention employs intracranial surgical delivery of non-replicating adenovirus vector encoding microRNA sequences that are targetable that target or lower Huntington's protein synthesis. In high dose recipients, the therapy achieved a remarkable 75% reduction in disease progression over a sustained 36-month duration follow-up period, and the microRNA construct demonstrated an extended half-life following administration, suggesting durable therapeutic potential spanning several years. Currently, or in at least some of the literature, as had been identified, a phase 1 clinical trial is or has been underway investigating ALN-HTT02, an intrathecally administered small interfering RNA, or siRNA, designed to sort of inhibit or silence sort of expression of the Huntington's gene. ALN-HTT02 specifically targets all HD-associated isoforms of the gene RNA, aiming to inhibit translation of the defective transcript. The approach is expected to reduce the production of toxic Huntington's protein aggregates without compromising the essential physiological functions of the wild type Huntington's protein. However, the intrathecal route required for ALN-HTT02 administration may affect patient compliance due to the invasive nature. Nevertheless, the long mean half-life of ALN-HTT02 supports the infrequent dosing, expected to be no more than twice yearly, and the trial is anticipated in amongst the evidence had been sought to conclude in around July 2028, with comprehensive reports on adverse events and changes in cerebrospinal fluid and Huntington's gene concentration to follow. So in around the conclusion then, complementary efforts employing investigations such as CRISPR being a particular sort of investigation under laboratory analysis, and Cas9 gene editing and stem cell transplantation further exemplify the shift towards the disease-modifying interventions capable of preventing or reversing neural loss. Rodent investigations under laboratory and under laboratory sort of environs, particularly uh, uh, particularly with a particular cell line, continue to provide a sort of important insights into the therapeutic efficacy and biomarker discovery through modalities, through through and around particular modalities for Huntington's. Although translation to clinical applications remains challenging, these sort of advances, combined with emerging biomarker-driven trial designs and neuroprotective framework, signify a transition from symptomatic treatment to targeted molecular therapy. Continue global collaboration in integrating and genomics imaging and clinical research is essential to refine these approaches, refine these sort of these approaches for Huntington's, and collectively the advances sort of foster genuine optimism that that Huntington's disease may ultimately progress from a fatal hereditary disorder to a manageable neurological condition. So that concludes this research poster presentation on Huntington's disease in the 21st century to an end. There are some references in as part of this research poster presentation, so listeners can check out some of the references to identify some similar works in around similar works in around in the varying amongst the varying themes of Huntington's that have been discussed or have been iterated in as part of this research poster presentation. Thank you.